My beautiful family, welcome back. This is Saima. I'm back with another video. In today's video, we are going to talk about OET speaking. I'm gonna give you my tips and tricks and how I passed my OET speaking subtest on or my OET exam in one sitting. So on this channel, I provide information about UK nursing, life around me, my life, NHS life, and each and everything we discuss that you can think of on this channel. If you haven't subscribed, please consider subscribing, and if you're new to this channel, welcome on board. If you're a returning viewer, thank you so much for coming back. As I said, in today's video we are going to talk about OET speaking and what are the things you need to consider when you are playing the role of a nurse in your OET speaking subtest, and what kind of questions you need to ask to the patient and in a correct and efficient way in order to pass your subtest of speaking. Right, so the first thing we need to we come across in OET speaking is getting information from the patient. So you are the nurse, you are going to play the role play, then you need to get the information from the patient. So when you are there to get the information from the patient, there are two types of questions you are going to ask the patient. Number one is a yes or no questions, and number two is information gathering questions. So in the yes or no questions, you need to know, as the term suggests, there are questions answerable by yes or no, and for the information you need to ask the patient, can you tell me more about it, or could you please tell me about this. So let's see some examples of yes or no questions first, and then we will discuss the other type of questions, information gathering questions. So now we are going to see a conversation between a nurse and the patient's mother, and I'm going to give you the answers and the questions. All right, so the nurse says, what happened to your son? The mother, she says, it was bitten by a dog. Right, has your son had any tetanus jab before? I think yes. So these are the question, like contain the questions. Mostly they start with W, right? So the questions starting with who, when, why, where, how also can be there. So these type of questions, the first thing you are going to ask, or you can ask the patient, what brought you into the hospital, or why you are here. So starting with why, where, all the question marks with the question. Yes or no questions, quite easy to understand. The answer would be yes or no. And the information gathering questions, they start with WHO. We often called it five wives and five wives and one husband means five questions with WH and one with HOW, how. So five wives and one husband. All right, so five wives. Okay, how do we need to remember it? You can just remember by saying five wives and one husband. What does that mean is you need to ask patients the questions starting with WH: what, why, when, where. All right, and also one more, I forgot, who. And then the husband is how. Okay, so these things you can remember, and whenever you go for a role play, you can remember the five wives and one husband. So you're going to ask the questions with WH, and you can include who, you can include why, where, what, okay, and how also in information gathering questions. All right, you can ask the patient, what happened, what brought you to the hospital, what happened to your son, or when did it happen, did you do anything to treat it, or something like that. So these are the questions you need to include to your role play. Then the second point I want to highlight here is about, can you tell me? Yeah, this is important, and you need to say it very, very clearly. clearly. You can tell, can you tell me what happened to your son? Can you please tell me what's wrong? Can you please tell me why you are here in the hospital? This kind of questions, these are the information gathering questions, and you can make sure that you use them in your speaking role play. If you are not sure about the patient's visit, you can also ask the patient, can you tell me what are you concerned about? Can you tell me what are you worried about? Can you tell me what you have difficulty with? So these kind of questions you can ask the patient. All right. And if you're not sure about the patient's medical history or a patient's medical or family history, you can also ask them questions. Are there any members of the family with hypertension, with diabetes, or any allergic, are you allergic to anything? So these are the information gathering questions. Make sure you ask those to the these questions to the patient. Have you experienced having difficulty with breathing before, or did you hurt your back before? All right. About present condition also, you can ask them some questions. Have you eaten anything today? Do you feel any pain in this part? Can you walk properly? Or have you got any a temperature? Have you got a temperature? Do you have a cold or headache? So did you notice that what kind of sentences I'm using, what tenses I'm using? If it's about the current condition, you're going to use have. If it's about the past, or if you are going to ask the question, then where, what, you know how to use those ones. And some information question nurses may ask their patients: when did you eat, what did you eat today, why did you not eat anything, or when did the pain in your leg start? So if we are asking any questions, we need to make sure our question is right and understandable. All right. And also we can use the does, do, and did in asking question. Do you have any children? Or does your children have any allergy? Do your children have any allergy? Or so auxiliary verbs are important. Does is used with singular subjects, present tense, and do is used with plural subjects, present tense. Did is used with both singular and plural subjects. So you can write down all this information and make sure these kind of questions you ask your client in your OET speaking subtest. People, they use have or has wrongly. You need to make sure that you use it in a correct way. Has is used with singular subjects, all right, and have with the plural subject. So has is a present perfect tense, and have is also present perfect, but they are used separately. The kind of role play the nurses get in OET speaking is treatment explanation, that they need to explain to the patient that the child or the patient is going to have some treatment. So nurses should have a good knowledge how to explain the treatment options to the patient, and they should be confident in telling the patient or asking the history of the patient. So let's say I say hi, let's say my patient name is Richie, and I say, hi Richie, I'm Saima, your attending nurse. What happened to you? What happened to your right leg? And patient says, it hurts. Why, what happened? Why are you crying? And then patient tells me the story. Then you need to you can say that, oh, I'm so sorry to hear that. Can I help you with your pain? Do you want to have some medications, or should I reposition you? What do you think we can do together, right, to treat this condition? So these are the things you need to give them questions. You need to ask the questions and get the answer from them. And you also need to include the patient in the conversation. It's not like you are just saying and saying and saying and patient is just listening. You need to include the patient in the conversation to have a better role play presentation. All right. So you need to remember, when you explain treatment to the patient, you use signposting. What does that mean is you can say a sentence like, these are the things I'm going to do with your wound. So what does that mean is you are going to do more than one thing. So patient would understand that the procedure is gonna be long, or you are going to do many things, not only one thing. You can also use a sequence, explaining in a sequence. For example, if you need to to do a dressing to the patient, you can say, first I will clean your wound, then I will apply the dressing, or then I will cover it. So you need to use the sequence also. First I'll clean your wound with the normal saline, then the doctor will stitch it up, and I will put a clean dressing. Just a proper example how you can use it. So in a speaking subtest, when you are giving explanation to the patient about certain treatment, you can use signposting language. Signposting, you need to use a sentence where it says you are going to do different things, or you can use sequence language. I mean, you can give your answer in a sequence, explain the treatment in a sequence, like firstly, secondly, thirdly. All right. So explain the treatment to the patient using conditionals. Conditionals, if or clause. So if I say, if I keep the wound dry, it will heal faster. All right. Or if deep wounds are not stitched, they are openly exposed to bacteria and will get infected. Just to give you an example. All right. If they are kept dry and clean, the healing process is faster. If you keep your wound dry and clean, it heals faster. All right. And because these are the things you need to include in your speaking test. I know they are just quite, they are simple words, they are simple to see it, or it's very simple for you to seeing me using them, because this seems like it's just normal way of talking. But I know when you go for the exam, you can't remember, or some people, they go totally blank, or they cannot concentrate properly. So if you take a pen and paper, you can write them down, and you can try to practice these every day in your routine. When you practice for OSCE speaking subtests, you can practice these. How I'm going to answer a question the patient, am I using 5 wives or 1 husband, or what are the explanation techniques I need to use in the speaking subtest, and if I'm using if, what I need to do in the second part of the sentence. All right. Also need to you can also include sentences like importance of that thing, that if I'm doing dressing, why is it important. You can tell the patient it is important for you to have the dressing, or you can go to it is important for you to it is important that you will have the vaccination, otherwise you will contract the deadly tetanus, or it is recommended that you have the vaccination, or it is important for you to have the vaccination, or you can contract tetanus or anything like that. What are the things you need to remember is, for these things you need to practice it with the partner, practice it with somebody, or practice in front of the mirror. All right. Because in the speaking role play, you're not going to excel it if you are not practicing it. Practice is very, very important. It will boost your confidence if you practice, and it will also encourage you to speak more, and to learn more. All right. Now I have a test for you. Write it down. Okay. You need to practice it with a friend. All right. This is your question. Have you gotten your pen and paper? All right. Tell a patient with hypertension that a medical technologist is to get her blood sample for lab. You need to explain how easy and painless it is to get blood sample, why she should be taken blood samples. All right. So you need to practice it with your friend or colleague. Have you written it down? No, let me repeat it again. Let me repeat it. Tell a patient with hypertension that a medical technologist is to get her blood sample for lab. You need to explain how easy and painless it is to get blood samples, why she should be taken blood samples. This is your homework and you need to do it. Let me know in your first go in how many minutes you did this role play. It's not going to take you long, only 5 minutes max. All right. Yeah, let me know if you practice it. The second question I have for you is, explain to a patient who has a respiratory infection why it is important to complete the medication of course of antibiotics. All right. So the second question, the second practice test for you is to explain to a patient who has a respiratory infection why it is important to complete the medication, to complete a course of antibiotics. You should start briefly with your introduction and inquiry about what happened to the patient. You need to make sure that you use all the information that I have given you in this video by in answering your question, in answering this test. All right, and let me know in the comment section. Please let me know. I want to know how it goes. All right, and whether you were able to finish this role play in 5 minutes or not. What did you learn? Did you practice it well? Were you confused or not? Were you confident enough in doing it? All right, I'll be waiting for your comments, guys. The third thing I'm going to talk about is giving advice to the patient. So as nurses, it is our responsibility to give some advice to the patient. Advice can be on different topics, can be on to take medication that's prescribed by the doctor, or to make lifestyle changes, or personal care, or social involvement. So these are the four things we usually give advice on in the OET speaking role play, and you need to accelerate. You need to make sure that you know how to give an advice. You need to know there are different topics, there are different conditions where you get a chance, where you get the role play to explain to the patient that they need to make some lifestyle changes in order to improve their health. So as a nurse, when you go for your OET speaking subtest, you need to make sure that you practice those conditions. You need to practice that. You need to make sure that you practice on those diseases or on those conditions where you need to explain to the patient what they need to do and how they need to do, what changes they need to make in their lifestyle. All right, so also how we going to do it, the conversation. I'm going to show you a little. I'm going to explain to you how nurses they do this session in order to give advice to the patient. So nurse says, hi, my name is Saima, I'm your attending nurse. And patient says, hi, good morning. Then you say, I read in your notes that you underwent thyroid surgery 3 days ago. So and then at the end, after getting all the information, the history a little bit, because you are new, you don't know, you just started your shift, you haven't met that patient before. Just consider each time that you haven't met the patient before, unless your role play says that you met the patient before. But if you haven't met the patient before, you need to introduce yourself. You need to gather the history from the patient, what happened, why it happened, and how you're going to do it, what are you going to do in order to improve your health. Okay, now this patient has thyroid surgery. So the patient, the nurse is taking history already. She's saying, are you okay, is there anything I can do? And she said, well, go ahead, you will be the best, you will be the first. Because what happened, uh, the nurse said, I read in your notes that you underwent thyroid surgery 3 days ago. Patient said, yes, I was about to say something about it. And the nurse said, well, go ahead. And patient, my throat is painful right now, my voice has been affected too, it is hoarse, I'm so worried, and may I ask when I can go home? I have examination next week at school, so I have to be there as well. It's usually, so the nurse says, it usually takes 2 to 3 weeks or more before you can go home. And patient says, 2 weeks, how can I take my exam? So the thing is, as you go through the conversation, patient can respond you differently, patient can give you different answers, then you need to know how to answer them, and how can you do it appropriately. So I'm not going to read all the conversation. And the final bit, the nurse said, let's see how you will be making progress. If you do what I've told you, it is likely that in 2 weeks you'll be discharged. By then, it is also important that you will be assessed properly by your doctor to check that you are fully recovered. All right. So the giving advice to the patient depends on the patient's condition and how they respond to you. Then only you would know that what you are going to say in order to answer their questions. But always make sure that you are polite in your response, you are listening attentively. And if patient says in one question, patient says he has pain in his throat, he wants to go back to school, he has exam next week, and what else did he say? He's worried, and when I can go home, I have exam next week. And when then the nurse says it usually takes 2 weeks, so patient is surprised that it's going to take 2 weeks. Then you need to make sure that you are confident in explaining that why it takes 2 weeks. So you need to tell the patient that we will be observing you, and we are going to do some blood test for you to check your thyroid function test. If everything comes normal and your doctors are satisfied with your progress, then for sure we are going to discharge you in 2 to 3 weeks. But make sure you need to know that never ever give an exact date, because you are not there to make false promises. And what you can also mention to the patient depends on your condition. So you are not promising that you are going to discharge the patient in 3 weeks or in 2 weeks. By saying that depend on your condition, you are saying that it is possible that you will be discharged by this date, by 2 or 3 weeks, but it depends on your condition. So you are giving answer in a ambiguous way. You are taking the you are considering it in a, you are taking it very serious from the patient point of view and from the medical point of view as well, because patient has thyroid surgery. So it is possible that their thyroid function test reports are not normal, or they develop anything else while they are in the hospital, or the doctors are not satisfied with the patient reports. So it's entirely on the patient condition. All right. So always make sure that you are not giving an exact date or exact time of the discharge. Always be very tactful in answering the patient. All right. So you don't put yourself in trouble. Okay. Let's say you are giving advice to a patient about medication. You can consider these sentences. You can say that there are few things I need to tell you about the medication, or there are a few things you need to know about this medication. There are few things you need to bear in mind while taking this medication, or there are some reminders you should know about the medication. All right. We must be certain about things that you must do to reduce your blood pressure. We need to be clear about things that you must do at home for the safety of your child. All right. We need to be clear about things you must do in order to take care of your throat. Okay. So these kind of sentences you need to use in your speaking test. While giving advice about medication, you can use these ones. This is an extra tip for you. All right. Also keep in mind or write it down, there are some expressions that you need to include when you give advice to a patient. You can say that you should is important in here. You should always take the tablet with food. Try not to overdo things. The most important thing to do, yeah, you can write these down because these are important. It would be beneficial for you to do some exercise. It is good idea to keep your daughter's fingernails short. Make sure you don't do a lot of things or a lot of talking. It would be very helpful if you try to lose some weight, or you need to continue on this diet until you lose some weight. Or I'm afraid it is extremely important that you don't pressurize your throat. It is best to talk to your doctor about the condition of your throat after 2 weeks. It is important. So the things I'm here saying here, these are the expressions you must include in your OET speaking when you give advice to a patient. All right. You should, you must not, you should not, or this would be beneficial. I highly recommend this. Or I'm reminding you, or you can use these kind of sentences. It would be very helpful. It is a good idea. Or you should always consult with the doctor before taking any medication. So when you're giving advice to the patient, these are the expressions you can use in your OET speaking. So when we add items, when we are saying something and we need to include more information, we can say also, as well, likewise, moreover, furthermore, or in addition, or what advice can you give me. Then the patient says, I've been having a fever for a few weeks now, what advice can you give me? This is your task, you need to write this down, and you can practice with someone, or practice with a partner or your friend or someone at home. What will I do with my hypertension? So you need to know how to explain to the patient if they're asking you these things. I have a sore throat. It began 3 days ago. I've taken some lozenges, but my throat is still bothering me. What do you advise for that? My migraine is attacking me. I cannot work with it. I called in sick from my job. I've been absent for 2 days now because of my migraine. So what I'm saying is, you need to write it down and explain hypertension, explain migraine, or what else was there, sore throat. So write it down and practice with your friend how you are going to give advice to the patient about these conditions. Yeah, this is your homework. So I've given you 5 tasks, 2 first ones and 3 these ones: sore throat, hypertension, and migraine. All right. Before you do the task, play a nurse patient role. Introduce yourself to the patient, ask patient what the problem is or why she came. Tell nurse your problem and ask for advice. Nurse explain things. So before you start practicing those 5 tasks that I've given you, you need to make sure that you know what you are going to ask. So your first question would be introduction of yourself and asking why the patient is here. Next, explain things to the patient about the medical condition or problem before you give your advice. Okay, if the patient says, I have sore throat, before you give your advice, you can tell the patient what the sore throat means. What does that mean? What does hypertension means? All right, what does diabetes means, before you give your advice to them. Okay, so the second part of this video I'm going to continue tomorrow, and I hope you like this video and it was helpful. If you did, and if you did practice the test, the homework I gave you, let me know in the comment section. And were you able to do it? Were you able to practice it at home? And I'm sure I cleared some of your doubts and you like this video. If you did, please give it a big thumbs up. You can also share it with your friends and colleagues who are preparing for English test, OET speaking test, or OET exam. Share it with your friends, and I'll see you soon in the next video, in the second part of OET speaking, because I've mentioned some of the bits in this session. In the next session we'll do the half. All right, thank you so much. Take care. Bye bye.